Did you know that someone has a heart attack every 40 seconds in the United States? Every 40 seconds. One person somewhere will experience the symptoms of a heart attack. A heart attack is a condition where blood flow to a part of your heart is blocked. Most commonly, this happens because of a blood clot in a coronary artery, which is the artery that supplies blood to your heart. Without oxygen, part of the heart muscle begins to die within minutes. This is why heart attacks are sometimes called myocardial infarction, which means death of the heart muscle. Globally, more than 80 million people die from cardiovascular diseases each year, making it the leading cause of death worldwide. So today, let's talk about heart attacks. The silent killer that often strikes without warning. I will discuss the definition of heart attacks, global stats, US statistics, as well as the 5 most common early signs. And most importantly, what you need to do if you or someone near you is having a heart attack. Let's get started. What is a heart attack? A heart attack, also known as a myocardial infarction, occurs when the flow of blood to a part of the heart is blocked, typically by a blood clot. This blockage prevents oxygen-rich blood from reaching a portion of the heart muscle, leading to the death of heart muscle cells. The most common cause of a heart attack is coronary artery disease, which occurs when the coronary arteries become narrowed or blocked due to the buildup of plaque. Plaque is a substance that can obstruct blood flow and reduce the amount of oxygen supplied to the heart. The severity of a heart attack can vary widely depending on the location and extent of the blockage. Some people may experience mild discomfort, while others may go into cardiac arrest. Early recognition and treatment of a heart attack are crucial to minimizing damage to the heart muscle and preventing further complications. But before we move on, please take a moment to subscribe to the channel. If you find our videos helpful, please support us. Global statistics on heart attacks. According to the World Health Organization, cardiovascular diseases kill 18.6 million people per year globally. That's almost half of all deaths worldwide. In the United States, heart disease causes about 1 in every 5 deaths. Each year, around 805,000 Americans have a heart attack. About 605,000 are a first heart attack. 200,000 are in people who already had one. US statistics on heart attacks. As mentioned earlier, heart disease is the leading cause of death in the United States, accounting for approximately 1 in every 5 deaths. In 2020, an estimated 696,000 people in the United States had a heart attack. On average, a heart attack occurs every 40 seconds in the US. The most common type of heart attack is the Saint elevation myocardial infarction, which is characterized by a significant elevation in the Saint segment of the electrocardiogram, otherwise known as an EKG. This type of heart attack typically indicates a complete blockage of a coronary artery and is often caused by a blood clot. 5 early signs of a heart attack. While the classic symptoms of a heart attack include chest pain, shortness of breath, nausea, and sweating, there are actually 5 early signs that you should look out for. These signs may not be as obvious, but they could indicate a heart attack. It's important to remember that not everyone will experience all of these signs, and some people may not experience any signs at all. If you suspect you or someone nearby is having a heart attack, call emergency services immediately. 1. Jaw, neck, or back pain. One of the less commonly known signs of a heart attack is pain or discomfort in the jaw, neck, or back. This can occur because the heart is located in the center of the chest, and the pain signals can radiate to other parts of the body. For example, a blockage in the left coronary artery, which supplies blood to the left ventricle, may cause pain in the lower jaw or neck. Similarly, pain in the upper back can be a sign of a heart attack caused by a blockage in the right coronary artery, which supplies blood to the right ventricle. 2. Cold sweats. Breaking out in a cold sweat is another telltale sign that something is amiss. When you experience a heart attack, your body goes into a state of shock, as it tries to compensate for the lack of oxygen-rich blood. This can cause your body temperature to drop and your skin to become clammy. The sudden onset of profuse sweating, particularly when accompanied by other symptoms such as chest pain or shortness of breath, should be taken seriously and evaluated promptly. 3. Unusual fatigue. Fatigue is a common symptom of a heart attack, especially in women. However, it's not just any type of fatigue. It's a sudden, unexplained, and persistent feeling of tiredness that can be a sign of underlying cardiac issues. This feeling of fatigue can be attributed to various factors such as reduced blood flow to the heart, decreased oxygen supply to the muscles, or the body's response to stress and hormonal changes. It's essential to distinguish this type of fatigue from regular tiredness. If you experience persistent fatigue, it's crucial to consult a healthcare professional, especially when it's accompanied by other potential heart attack symptoms like shortness of breath, chest pain, or lightheadedness. For nausea or vomiting is another sign that you may be experiencing a heart attack. It occurs due to the body's response to the reduced blood flow to the heart and reduced oxygen supply. Lightheadedness or dizziness can also be a sign of a heart attack. This sensation is due to a sudden drop in blood pressure or a decrease in blood flow to the brain. It's important to note that nausea and lightheadedness can be symptoms of other conditions. Still, when they occur suddenly and unexpectedly, they may indicate a more serious issue. 5. Shortness of breath. Shortness of breath is a common symptom of a heart attack, occurring due to the reduced oxygen supply to the heart and lungs. When the heart cannot effectively pump blood, the body may struggle to obtain sufficient oxygen, leading to feelings of breathlessness. This symptom can be particularly prominent in women and may manifest even in the absence of chest pain. It's important to pay attention to any sudden or unusual shortness of breath, especially when accompanied by other potential heart attack symptoms. If you or someone nearby is showing any signs of a heart attack, call 911 or your local emergency number immediately. Every minute counts during a heart attack. Quick medical intervention can save lives and reduce damage to the heart muscle. Who is at risk of having a heart attack? Anyone can have a heart attack, but some people are at higher risk. High-risk groups include smokers, people with high blood pressure or cholesterol, diabetics, overweight or obese individuals, people under chronic stress, and those with a family history of heart disease. Even young adults under 40 can suffer heart attacks due to unhealthy lifestyles. What to do during a heart attack? If you or someone nearby is having a heart attack, follow these steps. Call 911 or your local emergency number immediately. Do not attempt to drive yourself to the hospital. Chew a 325 milligrams aspirin, unless you are allergic to it. This can help reduce the size of the blood clot. Stay calm and sit down. Breathe slowly and deeply until medical help arrives. How to prevent heart attacks. While some risk factors for heart attacks are unavoidable, such as age, sex, and family history, many are preventable. To reduce your risk of a heart attack, eat a heart-healthy diet, rich in fruits, vegetables, whole grains, and omega-3 fatty acids. Exercise regularly, avoid smoking, manage your stress, and monitor your blood pressure, blood sugar, and cholesterol levels. By making these changes, you can significantly reduce your risk of developing heart disease and having a heart attack. Let me know what you think. Is there anything I missed? Please leave a comment below. Also, if you found this video useful, please share it with your friends and family. Thank you for watching. Have a wonderful day. Bye-bye.